Okay, I believe we are live right now. Welcome to Wellness Shots with Jewel. I'm Jewel, your host, and today I have amazing Dr. Brooke Goldner, with me. Hello and welcome.
Hi, nice to see you again.
It is such a pleasure to see you. And what I would like to talk about today is about COVID-19. I just did another interview a couple of days ago, and we were a little bit surprised and shocked that that could be that all the preventions are not necessarily, and there was a point of view that was expressed that all the social distancing and all the masks are not needed. So I know that you've been researching this subject deeply in the past few months, and I thought it would be great if you could share what you found and the science you came across, and just to share your opinion on this.
On the whole pandemic issue.
On the whole pandemic issue and on the if social distancing is something that we should comply with or not.
Yeah, absolutely. So the reason that people have been coming to me a lot for this information is because I specialize in disease reversal with autoimmune diseases. And so I focus a lot in my work on helping people get healthy immune systems. And so especially with something like a pandemic, a healthy immune system is more important than ever before. And so not only have I had a lot of success working with people personally, but I'm also very connected with people who are on the front lines of this pandemic right now. People who are working in hospitals, someone who's actually heading the response at the Cleveland Clinic. So I'm very aware of really what the impact has been of the disease, as well as social distancing and all the different measures we take. So it's actually alarming to me whenever I hear somebody say that this is not a real thing or that it's a hoax. It makes me wonder where this is coming from. Because I mean, I know that politically it's advantageous to say it's not there. We want the economy to go better. It's better for the stock markets. But in terms of a medical illness, this is a real infectious disease. And a lot of the arguments people are using to say otherwise don't hold up when you look at it scientifically. So this is a new infection, and it is an extremely contagious and infectious illness. And it spreads very quickly, and it spreads in ways that's profoundly different from things like the flu. And one of the best ways that we can protect ourselves from this until we have some kind of effective treatment is measures like physical distancing or social distancing, things like wearing masks and goggles. I actually wrote a whole article about this that was on the Today Show about proper usage of masks, because it works. I mean, you look at, what happened in New York. The reason they flattened their curve is because they immediately shut down. And now their curve, the reason we call it flattening a curve, I have curves I can show you if I can share my screen, but otherwise, normally it goes up, and then if it comes like this. So New York right now is finally taking the first steps to opening up, but they're doing it in a scientific way, that the numbers are down. They're opening up in a minimal way, the first stage of opening up, and they're doing it with everybody required to wear masks out in public to protect others from your contagious particles, right? That is how we should do it. And when you see a model like New York, where that's what we're doing, we went from one of the worst outbreaks to one of the best situations, versus where I live right now in Texas, where we didn't really have much of a shutdown at all. And then they really opened up fully all the way. I mean, nobody's wearing masks out there. Supermarkets are full. People were out crowding around at parties in Memorial Day. And our line is straight up right now. We're having record hospitalizations, 2,000 cases a day. We're at the highest peak we've ever been, and it's still going up every day. So it's very apparent if you follow the cases and you follow the measures people take, what happens when you don't shut down or shut down effectively versus when you do. And it's really as uncomfortable as it is. I think we all have burnout, right? I mean, I feel like when I see my hairdresser again, I'm going to be like, Scarecrow, I missed you most of all, right? Like I miss going out. I miss going for walks in shopping centers. I miss being able to do the things I did before. But scientifically speaking, it doesn't make sense yet to open things up unless your curve has come down because otherwise we're just going to continue this and it's going to stay around longer. So anyone who tells you otherwise, who says that masks aren't a good idea or that you shouldn't be distancing yourself, it's not scientific, and it's dangerous too. It's dangerous to human health. People are dying. People are dying from this illness, and it's these measures that will save lives.
And the arguments that we hear from opponents saying that it's just like a regular flu and it's okay to get sick and build the immune system by getting sick. But what are the dangers involved?
Not at all. Think of it this way.
Thinking?
All right, this is not a flu. It's not a flu. I have a friend who's a cardiologist who's working in the hospitals. And one day she posted on Facebook in all caps, "It's not a flu," like 100 times. Like she's just like, because it is far worse. You think about the flu, between 30 to 50 million Americans get the flu every year. Out of 30 to 50 million people, about 24,000 can die. And most of those people are elderly or immune compromised. Look at COVID. COVID, we have about 2 million cases in the US, over 100,000 deaths. It is way more deadly. It's also way more contagious. The flu, the way the numbers that we look at on how contagious it is how many people get infected. Usually it's about, for every one person, another person gets infected. COVID with social distancing, it's about 1 to 2 or 1 to 3. Without it, much greater. The flu, if someone coughs on you or sneezes on you, you can get it. COVID stays around in the air. The sick person can have already left the area and you can walk through their droplets and get sick. It is more contagious, it's more deadly. Plus for the flu, we have treatments. We have vaccines that help with the worst forms of the flu. We have medical treatments that people can take, antiviral medicines that can shorten how long you have it, right? We have all these different treatments. With COVID, we do not. It's very much a roll of the dice. Are you going to be asymptomatic and just be a carrier? Are you going to have just some fevers or some diarrhea? Or are you going to be the person that ends up on a respirator? That is a roll of the dice that I don't really like to see. And the people who are getting it are not just the elderly or the immune compromised. When you look at the people dying of this illness, there's a lot of people who are in their 40s, who are in their 30s. We have teenagers. We have a friend who, super fit guy in his 40s and no health problems, ended up on a respirator, almost died. And he's still not the same, even after coming home from the hospital, and mentally and everything else. He's still he's not quite back to where he was. Right? I have a high school teacher friend who lost 2 of her students, died. She's a high school teacher in New York, right? So this is not what the flu looks like. And anyone who's comparing it, again, they're not using real science. They're not looking at the differences between the infections. And it's really to the detriment of the people who are out there who could potentially get sick or die from this. I'm a super healthy person. I haven't gone out in 3 months. I'm getting my food delivered. We're doing everything we can, because even if I'm going to be a carrier, I don't want to be out there exposing people. It's just, I'm doing what I can to not be a part of spreading it. And that's what we can do, is that, the people, my friends in the hospitals are begging people, please stop going out without your masks and your goggles and everything on, because we're overwhelmed in the hospital. We need you to stop infecting people. We need you to stop, because we can't do this. My friend, one of his nurses, friend's a doctor, and one of the nurses who works with him, she didn't know that she got infected working in the hospital, and she infected her husband, and her husband died. So because she's in the hospital helping patients who are suffering from COVID, she now lost her husband. So, we have to remember this, that we need to do our part to protect not only ourselves, but everybody else. And those are the measures we need to take. And if we do it aggressively like New York did, this will end a lot sooner. But because we're not, now we have another wave coming, and in Texas, it's a straight line. I mean, there's no sign of it bending right now. And it's true in Alabama and many other states right now, Florida, where because they haven't taken these measures, we're not getting we're not leveling out that curve. We're not slowing this down. And it's perpetuated by these myths that people are sharing.
Yeah, thank you. Thank you for speaking up. So now that we opening up slowly, do you have any suggestions how this should be taken? Like, should we start going out, and are there any precautions that we should take anyway, even though that the cities and the states are opening up?
Yeah, so really, we should be making these decisions based on what's happening with the illness, not based on what we feel, right? With H1N1, for example, the CDC led the response. And every day the CDC updated all the governors and they were able to kind of manage things. We don't have them leading the response now. And even the CDC guidelines, it hasn't really been shared with the public very much. In fact, it got vetoed by the government and sent back. But now if you go online, you can actually read it. And what the CDC recommends is that the decisions about opening up should be based in stages based on what's happening in your specific state or city with the illness. So if in your area, the numbers have gone down and that curve is flattened, then it makes sense to start opening up, but in a limited way. So going out, but if you go out only when you need to, not just, going to parties, going to groups, places, avoid areas where there's recycled air. I'm not, I have someone who's working with me for reversing her autoimmune disease, and she was asking me what I think about her going back to school. And they said they're going to space the kids out, like most kids are adults, it's grad school. They're going to space them out like 6 feet apart. I wouldn't, because it's recycled air. It's the same reason why people get sick on planes, right? So I would avoid situations where you're sitting with people breathing the same air as them. Go out, wear protection, wear masks. When you wear a mask, make sure it has a seal around your nose and mouth, because the virus will find the path of least resistance. So it'll just go around, right? So wear a good mask that covers your mouth and nose. They've shown that people are getting infected through their eyes, through droplets. So I've been saying all along, wear glasses or goggles, because now they're having people who have been wearing masks who are still getting sick, and they're realizing it's through the eyes, whether they're wearing a mask on a plane or nurses that are wearing masks but not goggles. So when you go out, I know it feels weird. It's kind of a weird, embarrassing thing to be like mask and goggles and kind of going, this is what you can do to protect yourself. And even if you feel healthy, if you happen to be a carrier, because carriers are the primary people spreading this right now. The sick people are home or in the hospital. Carriers are spreading it. Make sure that you're wearing it just as I think we were talking last time where we said wearing a mask is an I love you, right?
Yes.
We were talking about that, right?
Yes.
Good. Yes, I thought so. Ever since we were talking about that, I've been saying that wearing a mask is an I love you to other people, to just not breathe on them. Keep your distance. 6 feet is a minimum, but it can travel farther than that. If someone has a really explosive sneeze, I keep much greater distance than that. I do go out, but I go out to ride my bike or take walks. And when we see other people, we cross the street. Before COVID, that would have been rude. Nowadays, that's just friendly. That's an I love you. I'm going to cross the street and not be in your space, right? So go out to get fresh air, to be in nature, to do the things you need to do, but wear protection. Don't go into crowded spaces. Don't get into group get-togethers. We still need to wait. The scientists are working hard, but they're going to be much more successful if there's less cases to treat right now, because until the scientists have the answer, the hospitals continue to be overwhelmed. I mean, I just saw Alabama's out of ICU beds. Here in Texas, I'm in Houston, beds are full. We need to give the doctors a break, and people are getting worn out. I mean, there's even been suicides of healthcare workers that are overwhelmed, and by not only how much they're working by, but by the how traumatic the deaths are. It's if you're not there and you're not talking to those people, it's easier to brush that away. But we still need to treat it like it's a big thing, even though we're tired of it.
And another thing that comes to my mind is when they say about the risks of staying home for 3 months, do they really outweigh the risks of being infected or carrying or transmitting this infection?
What risks are you talking about? Are you talking about the economy? Or are you talking about immunity?
Whatever the risks are, like about the immunity, I think there is a lot of arguments about the immunity, that you're sitting home, you're not active, or the other things about mental health, or there are other talks about, of course, about the economy. Mm-hmm. But like when I think about the risks, the risks of me and my loved one dying do outweigh. Like me personally, I would stay home and
1,000%. Yeah, 1,000%. So here's the thing, there's this idea of herd immunity, right? So if everybody has already got antibodies, there's some greater protection. The problem is COVID is so new, that we don't really know exactly what happens after you get it yet. They have not proven yet that people with antibodies are immune. That is a key component of herd immunity working. is that there's immunity. We don't even know if there's immunity. Now we have had some information from China. Can't trust all the stuff coming in from there, unfortunately, but they have reported that there's been people who had antibodies who then started showing symptoms again or started showing viral load go up. Wait a minute, right? So we don't know yet. So again, this is why we need to wait, because we need to find out this information. Are people actually immune? Because if they are, when I was talking to the head of the Cleveland clinic's treatment and approach to this, they were saying if that was true, if after you get it, you're immune, then they can start a program where, I don't know, you get a bracelet or something. So you're allowed to go out in public again because you got a bracelet that shows you're immune, right? But we don't know that yet. So still, even after people have gotten it, they need to wear protection, even after they've recovered, because we don't know. So we don't know enough to say that there's immunity yet. So we have to wait. And as far as what staying home does, you know, it's interesting. If you have a point of view that you want to stick to, you can always find information to support it. I actually find it's quite the opposite, that for people staying home, what I've done is I've said, now you have an opportunity to do self-care on a greater level than you ever have before, right? Because you have to be home. So what about starting meditation? What about starting a new art project? I had one client was doing rapid recovery with me, and her dream was, when she was a kid, was to play violin. I got her that day to order a violin and start online lessons, right? Why not learn a new language, right? We can use this time to have greater self-care. We can use the time to exercise. I'm telling people, go out in nature. Just don't go to a public park with everybody all over each other. But we can absolutely create schedules where we have self-care, where we have connection with others through Zoom and other things like this. And also exercise. We can do all of those things. We have to schedule it. We have to prioritize it. We do need connection with other people. And so that's a harder part. We do need to use technology. There are some people who at this point are starting what I call pods, which I think if this goes on for years, we're probably gonna have to do that, where there might be people that you will see, maybe they're your family members or something, but you have an agreement that none of you goes out without a mask on, all of you meet guidelines, maybe you get tests on a regular basis. I had someone in California who said that they were told to get tests every 5 weeks or so. Are you in California?
I am.
Yeah, so you get tests, right? But maybe, you know, especially if this is gonna go on for a while, we might have to start forming some pods of people we trust, you know, because I think that would be very hard to not have anyone else in our life for, you know, until we have some other treatment. But we really do have to be cautious, and we have to make those decisions wisely and not based on just our emotional desire to be out, but just what makes the most sense. And you're right. I mean, we have to protect ourselves. Now, the other part of it, that whole, you know, that it's bad for your immune system, it's not true at all. I mean, you're fine. Your immune system's still getting a workout with all the different things that are in the air and everything you're doing. And in fact, if you want to improve your immune system, drink green smoothies, drink your water, exercise, do self-care. All of those things improve your immunity, not going out and exposing yourself to a deadly virus.
Yeah, thank you. So what are your, I don't know if you have any predictions, but if we do follow all the precautions, what do you think? When can we get out of this?
I don't have that answer, you know, right now, because the scientists don't know this. There's different prediction models. Some of those models were based on everybody locking down, and now that we haven't, they're kind of going the other way. We don't know yet. We don't know if this is going to stick around or if this is going to become, you know, a yearly, annual event. There's all these theories out there. And as you know, from what I teach with my nutrition, is that I don't like theories. I like results. Right? Because theories, they're wrong a lot of the time. So I try not to prognosticate in an area that I don't have the results and information to do that. I'm just listening to the people who are on the front lines who have the best information. You got to be careful where you get information, right? You want to learn how to climb a mountain, go to someone who climbs mountains every day, right? You want to learn how to eat to heal, talk to me. You want to learn how to predict a model of a virus, you're going to go to the scientists who do that. So I'm following that closely. I'm looking to the people at the CDC, Cleveland Clinic, you know, all the people who are in the front lines of trying to design this World Health Organization. I'm looking at the information there, as well as talking to the doctors that I know that are actually in the hospitals treating. But nobody really has a sense of that yet. All we know right now is the infection rates are not slowing down.
Thank you. So I have two more questions. One is your view on vaccines. If they are coming up with the vaccine, would you recommend people to do it, wait for a while to see if the vaccine has a side effect? What's your view on that?
When you bring up a vaccine issue, immediately there's like, you're going to get, like, anytime I even mention a vaccine or anything, I get unlikes. Right? People are so scared of things like vaccines. As I said, I like what works. You know, I'm a Western medical doctor. So even though I help people get off of their meds using supermarket foods, sometimes medicines are necessary or useful. Right? So I'm in that realm of, if something works and it's useful, we use it, while also doing everything we can to not rely on medicine, right? So as I said, do everything you can to optimize your immunity, exercise, eat well, and nourish your spirit. But if they come out with a vaccine and it's proven to be effective, I won't be the first one to get it. I want to wait and see how the first round goes. Honestly, I'm going to wait and see how the first round goes, you know, because I'm staying home anyway. So let's just see how the first round goes. But if they develop a vaccine and it works, then I would do it, you know, and a lot of people get really mad about that. I understand it. There's a lot of distrust of the medical world because of everything we've learned about, you know, how doctors are taught about medicines and not nutrition. And I'm a part of the change in that area. But, you know, to me, it's what works. You know, polio was eradicated with a vaccine. There are vaccines that have been effective. Mm-hmm. Are there risks? Always. But right now, COVID is a very high risk. So if they develop a vaccine that can eliminate the illness and create resistance and eliminate this curve we're looking at, then I will look at that as a victory. You know, so yeah, personally, yeah, I'll do it. But I'll wait for the second round just to make sure.
But again, you are not at high risk. But for people who are at the high risk, that could be an option, a good option.
Right. And the thing is, we don't even know, because again, there are some people who are not high risk who are getting sick and dying from this illness. I just read an article yesterday about a couple where both the mother and father just died of COVID, and now one of their children is raising the other 5 children. And neither of them were high risk. Right. So it's scary. And I don't want people to get all freaked out and stressed, but we do have to take that seriously, that we don't necessarily know. I was reading some research that was showing that it was in an article in Immunology Research magazine, where they found that in some people, COVID is creating what looks like an autoimmune disease. Right? We know that in children. There's children now that they're realizing that children aren't coming up with it in the same way as others. So they're not getting all of those, you know, fever and those kind of symptoms, but instead they're developing an autoimmune disease, inflaming their blood vessels into their brain, temporal arteritis, which is deadly for the children. So on the one hand, it could create autoimmune disease symptoms. It can cause respiratory failure. It can cause strokes. We all have different risk factors depending on our own genes. So again, we don't know enough to say, am I high risk or not? Because a lot of people who are dying, their only risk factor was obesity or heart disease. Most people in America have some obesity or heart disease, right? So I think we don't know well enough to say who of us is really high. We know some people who are definitely high risk, you know, someone who's super old or super immune compromised, but many of us don't know. So my position has always been to use what works. I try not to make anything I'm doing a religion, you know, it's not a cult. Right? I teach only what works. That's really all I care about. And when it comes to nutrition, plants work. And sometimes people also need medication. So, you know, I have a client that I reversed her lupus. She's a doctor. She's an emergency room doctor. Worked with me, eliminated lupus completely. And she was actually in the process of switching to doing a plant-based lifestyle practice, because she fell in love with being able to help patients the way I helped her. But working in the ER, she got COVID. And so her husband called me and said, what do we do? I said, do your smoothies, do your water, and take whatever medicine you need, because you got to survive this, right? Whatever works, whatever works. You need help breathing, you take the breathing treatments. You need help with an antiviral medicine, anything whatever works is what we got to do. And we have to stop, you know, trying to stick to just different kinds of ideology, but really just be in the moment of doing the best thing based on the best results. So it's not always a popular opinion, especially when it comes to vaccines, but that's the way I teach it.
Oh, thank you so much. I kind of agree with you on all the things that you just said. And yes, my last question was about how we can boost our immune system to resist COVID-19, or to at least higher our chances to survive through this.
Yeah, so that's one of the good things is there's a lot we can do to get the healthiest we can be. You want to decrease your risk factors, then you want a healthier heart, you want to be healthier weight, right? You want to do the things you can to optimize your immune system. That's going to be your diet and lifestyle thing. So everyone has the ability to do this right now, right? So, you know, my husband and I give out free recipes for things like green smoothies where people who aren't used to eating healthy, just drink it. Right? Add that to what you're missing so you're getting all your vitamins and your minerals. Don't take vitamins over the counter. Get your vitamins from the food, right? So you do the vitamins and the minerals and the antioxidants from the smoothies. Make sure you're getting your water intake. I really recommend people drink 96 ounces of water a day to really hydrate, and it optimizes immunity. You pee a lot, it's worth it. And also exercise, getting out there, move. Don't sit in your house all day. Don't sit and watch Netflix with a bottle of wine and a bag of chips, right? Get out there and move. If you can only walk for now, then walk. You want to ride your bike, maybe do little spurts of jogs as much as you can, right? Get your body moving. Maybe use YouTube to get some workouts in, or some yoga in. There's my friend is doing, she's doing video kickboxing. You know, like you can get into all different kinds of things, but exercise and manage the anxiety and the stress, because anxiety, stress, depression, they're all inflammatory. They actually activate our inflammatory pathway, which makes us more vulnerable to being sick, lowers our ability to fight. That's why people often get a flu or a cold after a really stressful time at work or finals at school, right? So you want to manage your stress. So now's the time to look into activities that you can do every day just to be happy, whether it's meditation or laughing with your best friend on the phone or FaceTime or doing some kind of artwork or the violin, whatever it is. Make sure every day you're doing stuff just to feel good and happy, because it's actually better for your health.
Thank you so much. And do comply with regulations. Wear
Yes.
the mask, keep social distancing.
Wear the mask. I just read something where someone was trying to say that that wearing masks will make you overdose on CO2. And like, how do surgeons last 10 hours in surgery with a mask on if they're dying from CO2? They'd be dizzy and making mistakes on the table. It's not true. The CO2 molecules come out just fine. You do have to smell your own breath. But other than that, no, it's very protective. So yes, still wear the mask, wear your goggles or glasses if you go out. Just do it for now, because hey, listen, I would like the conspiracy people to be right. I actually would. I would prefer this to be a hoax and we all stayed inside for no reason. That would be the best outcome, right? But just in case they're not, wear protection and do your best to stay safe and keep your family safe.
Yeah. Social distancing and masks is a new I love you.
Is the new I love you. Yes.
I love you, Dr. Brooke Goldner. Thank you so much for coming to this show. Thank you for everything that you're sharing. And I would encourage everyone to go and look for all the wonderful work that Dr. Brooke Goldner posts on Instagram. Yeah, I think you're most active on Instagram.
And Facebook and YouTube. I'm there every day.
Okay, thank you so much.
You're so welcome. Stay healthy.